Welcome to the Pelvis Party, a health talk show in partnership with Olmsted Medical Center, where experts and guests dive into real conversations about hormones, sexual and pelvic health, and everything in between. We're creating a space for honest, judgment free talk. There are no dumb questions, no awkward topics, and definitely no shame.
Hi everybody, welcome back to the Pelvis Party. My name is Becky Mopetit. I'm with Rochester Local, and I've got two guests again today like we always do. I'm joined by Dr. Chris Klingo, Urogynecologist at Olmsted Medical Center, and Dr. Melissa Richards, Division Chair of Hospital and Surgical Services at Olmsted Medical Center. Welcome back.
Thank you.
It's great to have you back. I think this is your third appearance
Ooh.
on Pelvis Party. We might get to start calling you our semi-regular guest.
Does he get a jacket?
Oh,
Like
yeah.
a 5-time jacket?
No, we give our special guests a special cap. Put a feather in your cap.
I like it.
Yeah, perfect. Okay, you know what? We're going to go back and talk about urinary incontinence because it's kind of your jam. It's kind of your specialty. It's kind of like...
Pee in your pants.
Pee in your pants.
That's what I do.
Not
pee my pants, but...
and so if you haven't had a chance, if you're just tuning in for the first time, we've got some other great Pelvis Party episodes that talk all about urogynecology, all about peeing your pants, all about pelvic organ prolapse. We've got all kinds of really great content about what a urogynecologist is. So if you haven't seen that, go back and check those out and then come back here. So today we're going to talk about uncommon urinary incontinence questions.
Sounds good.
All right.
I like it.
So here the first question is, when could someone experience urinary incontinence and when is too young?
So as far as age-wise, I would say, once you get control, potty trained, and kind of have control, you can really see it or start, almost at any age. I think some of the younger women, girls, adolescents, there's things that run into bedwetting issues, and also some kind of habit issues.
Okay.
Recently saw a younger woman, but growing up, her mom was always like, no matter where you are, what you're doing, you try to go pee every time you can.
Oh.
So she did that fine. But now she's in her 20s and, working, living, and has trouble holding her urine more than an hour.
Oh, yeah.
And it took us a while to dig through that. Well, she just has trained her bladder over 20-some years to go every hour. And now she's at work and has issues. So that's a unique situation. But I would say, really you can start leaking kind of at any age once you have control. And also you can start at any age, like late in life. Some women, 60s, 70s were fine, and now all of a sudden they start having issues.
Yeah, okay, so the main thing is to be really aware of it and to bring it up with your primary care provider, and make sure that you're having good open question or open dialogue, which leads us to kind of our next thought is that at every wellness exam, this should really be talked about, just like any other...
It's part of national guidelines.
Yep, to talk about if you're experiencing any incontinence. Okay.
Yep.
So what happens if a person is visiting with their primary care provider and it's not mentioned? How would someone go about bringing that up?
Sure.
You say you have to go to the bathroom like at least 4 times during the visit, and maybe.
Yeah, right.
And it's hard. We focus on women's health, and we have kind of, specific things. A lot of the primary care doctors we work with, you got to realize they are covering head to toe, and they're trying to hit big things too.
Yeah.
So I wouldn't say it doesn't mean they're not interested.
Sure.
It just means we're trying to keep things moving and hit the big things. So if you have, I'd say if you have trouble bringing it up, so things I would say, some people bring a friend. And you're my wing person. And when there's that pause, anything else you want to talk about,
the wing
that
person
says, hey, we want to talk about incontinence and start the ball. I've seen that. Having a list of objectives.
Yes.
A lot of women, as I'm starting to notice, my memory's going. So you have a piece of paper.
Yep.
And you know, and that way you read it. You don't have to worry about being as nervous.
Yep.
And you
I
can
am a
just-
list person.
Yes.
Yep.
And just say, you know, there's one more thing I'd like to talk about, and I'm leaking urine, or I'm having trouble peeing my pants.
Yes.
And that way you read it, and that hopefully gets, you know, a dialogue started.
Yep.
Especially if it's impacting your life. Like,
Yeah.
this is where I get a little frustrated because, you know, we screen for so many things.
Yep.
We talk about so many things at our visits, but this for many women is like it's a control issue in their life. Like their urinary symptoms make decisions as to what they're going to do, and they make. I couldn't imagine getting up 4 times at night to pee, and we have patients who do that, and they're like, "Oh, I just get up 4 times at night to pee." That's wild.
Yeah.
Or like every time they see a rest area sign, they're like, "Well,
Better go.
Better go. I've trained my bladder that's what we do." Yes, even like talking to the nurse, I think is a good person to talk
Oh,
to
sure.
to make sure it's written down. The nurse will write it down, or sending a message, right?
Great. Yeah, all those things
At
work.
OMC, we have My Chart, so you can send a message through My Chart.
I love my chart.
It's good. It's a good way to communicate.
Yeah.
It's a tool, right?
Yeah.
So we can use that, and we can start a conversation. Because sometimes it's also not just an inconvenience; it can be something more like concerning,
Yeah,
right?
concerning, yeah. You
Absolutely.
want to address that. So, okay, so we're talking about uncommon urinary incontinence questions. Here is one that I think people would never want to ask. Where is the urethra?
Great question.
I mean,
It's
because
down there.
yes,
Okay.
right?
And again, not uncommon, and I would say a lot of women just don't know, don't look, don't want to know.
Fun fact.
Fun fact.
I have a family member who has 3 daughters who thought up until probably 10 years ago that women had 2 holes. Totally.
Oh.
Like, that's it. I'm like,
Well, which
total.
But talk about which 2 holes they thought they had, maybe.
Vagina
Just for
and
others out there.
yeah, vagina and rectum or anus. They thought poop comes out one hole and then babies and pee comes out the other hole. I know, right? Because people don't know. So back to
Right.
educate. Urethra, where is it?
Yes.
So I always encourage, you know, just like self-breast exams, skin exams, you know, having your partner look at moles, you know, get to know your vagina, vulva,
Absolutely.
that's the outside. You know, or Google it, look at pictures.
Yeah.
Because a lot of times we'll see women that, you know, UTI, but when you talk to them and you say, where does it hurt? It's like, well, it's actually where the pee or urine comes out, which is the urethra. And it's a skin thing. It's not even a bladder thing, but they've been treated for, you know, UTIs from it. So,
What would be the easiest way to describe? It's hard to verbally describe it.
so right. So you've got the clitoris, which is, I would say, on top.
Yep.
And then about a centimeter below the clitoris, there's an opening. Now, if you look, sometimes you can't really see an opening because your skin and kind of tissue wants to keep it kind of closed.
protect it, right?
So it's you've got the clitoris, you've got the fold, which is the little skin covers clitoris. Right below that, about a centimeter, normally is the urethra.
Okay.
And then again, a little below that, then the vaginal opening.
Yep.
Now, you know, yes, the urethra is technically, you know, within the vagina as a whole, but it is a separate hole.
It's separate.
You're right. And, you know, there's a lot of conditions that affect that. And I would, you know, it's awkward. I think we're getting better at it. But like knowing your anatomy, you know, even if it's looking it up.
Yeah.
A lot of us, we have like picture pages that we can draw on, and we say, show me where it hurts, show me where it itches, show me what bothers you.
Sure.
So I hope
I
that
think,
helps.
you know, sometimes there's a lot of shame associated with knowing or looking or whatnot. And I think you
It's
brought
been
up
drilled into our heads.
right. You brought up a really great point. Like people are doing breast exams, people are doing skin checks, people are doing these sorts of things.
Yes.
And really getting to know these very important parts of your body that you can't see.
That work very hard.
We're very
Work
hard
so
workers.
hard.
Very hard workers. So now that we've talked about where the urethra is and a little bit about getting to know our anatomy down there, when and how often should someone get a pelvic exam?
Yeah, I'll take that as the
Yes.
general
Yeah.
obstetrician
Yeah,
gynecologist. this is where we have to remember pap smear and pelvic exam are two different things, because a lot of people think, oh, I don't need a pap smear. Pap smears are depending on your risk factors, every year, every 3 years, or every 5 years. For sure, when you're due for your cervical cancer screen or your pap smear testing with HPV testing typically, you're going to get a pelvic exam. And then I make sure to have a really great conversation with my patient about, are you having any symptoms? We get into the nitty-gritties of everything. There are certain clinicians who will do a pelvic exam for every patient who comes in for a well exam. I don't think there's anything wrong necessarily with doing that. I don't, in my practice, do pelvic exams every time I see a patient for a well exam after doing a very detailed history. And then sometimes the pelvic exam may be just looking externally. Sometimes it will be a speculum exam. It might even be testing. And then sometimes it's feeling the uterus and where the ovaries are and the pelvic floor muscles. So it really tailoring it to each patient is very important with a really good history. I think that's clutch. I think oftentimes, urinary incontinence is a great example. Like if you're not saying it at your well exam, you might not get a pelvic exam, but having that conversation then typically warrants a pelvic exam after that, if those are some symptoms you're having, like peeing your pants.
Yep. What you said about having a really well-established history, I think is just really important.
Right.
And just making sure that you're talking through with your primary care provider your experience and these sorts of things and establishing that history. Go to the doctor, right? Go to the doctor.
Right.
Go to your care provider.
And it doesn't mean you don't have to get naked when you go see your doctor. You don't have to get naked when you see a gynecologist even. Like there's choice there. Like there's that's really important to feel comfortable to do that. It's something very like humbling and a privilege that we have to be with our patients. And as OBGYNs, I think, we have the best patients, right?
Yeah.
And I, as a guy, male in this setting, I always ask. I'd always say, I think it'd be important. I'd, like to do an exam. I always say there's going to be someone in the room with us, and I always say, "Are you okay with that?"
Yeah.
Right.
Or
consent.
And then I also bring up, have you had bad experiences with that in the past, or do I make you uncomfortable in that setting? And just bringing that up, that they may say, no, not today, and that's okay. But maybe we'll bring it up next time.
Yeah.
And just kind of saying, okay, here's what we're thinking, and again, let them have the power to kind of be able to.
I like that. I like that. You've put the patient in the driver's seat.
Yeah.
You're giving them the opportunities to make their choices that are the best for them, and showing compassion and empathy.
Yeah, saying it's important and we care, but we also care about how you feel and how, just the fact you're here today is great, and let's kind of work on that and just go from there.
Yep. All right, so we've talked a lot about some really uncommon questions, but what are some of the warning signs? When does someone need to be aware that this has gone from an annoyance to you really need to be talking to someone? I think that's really important for people to start internalizing about urinary incontinence.
So again, I would say some warning signs. Most of the time incontinence, there's nothing bad going on. It's unfortunately as a result of life experiences. However, like rapid acute changes that, hey, I saw a woman the other day, I was fine until like Christmas, and then all of a sudden I just started gush. She literally was like gush, like I would stand up and it would just gush out of me. And I'm like, never had this issue before, not even urgency. I had to hurry. So when there's quick changes, I would say that's always time to be seen. Maybe an infection, lots of simple things. The next question, as I think Dr. Richards brought up, is, there's incontinence that happens and it's like, oh, I should have gone, I didn't, I coughed really hard. When it starts affecting your choices, women are not seeing their grandkids, women are not playing with their kids outside. Mom, come jump on the trampoline with me. Mom, play kickball. I don't want to. I can't right now. It's those, when you notice you're missing out on things, that's when I would say, hey, there's some things we can do to get you more active.
Yep. And I think we talk a lot on this series about not settling. You do not have to settle for the symptoms that you're experiencing. And there is no shame.
There's no shame.
There's
and
no
if
shame.
you don't get that experience from your healthcare clinician meeting those expectations, get a second opinion.
Yeah.
Absolutely.
Yep. Do not miss out on your lovely life because of these things that you're experiencing, right? That's when we've got you experts here.
So good.
Thank you for what you do. Thank you for being on Pelvis Party.
Thanks for having us.
So delighted to have you join us. Thank you so much for joining us, and we will see you next time.
Thanks for tuning in to the Pelvis Party. As we always say, there are no dumb questions, and this is a safe place to ask them. So please drop us a line, let us know what's on your mind for a future episode. And as always, like and follow for more.